We all feel it. A desire to fit in, a want to be accepted, a need for a place where we feel we belong. Who we are and who we can become depends on how we go about filling this desire. Today, I would like to focus on a method that is becoming increasingly popular in Massachusetts. This method being the use of opioid drugs, such as heroin and methamphetamine. The epidemic is real. It's worse than we initially thought. When it comes to drugs, the answer is simple. Choose to live. Opioid drugs, such as heroin and methamphetamine, are currently widespread in Massachusetts. These drugs were initially created as painkillers due to their ability to attach to pain receptors and inhibit their function. Many people began using opioids, such as Oxycontin, due to both a severe injury and a doctor's prescription. Many of them became hooked on the medication and then continued to buy it, due to the intense high that it gave them. Eventually, these high-quality drugs became too expensive for them, and so they switched to cheaper opioids, such as heroin and methamphetamine. These drugs are much more dangerous to use. Heroin, for example, often causes hypoxia in users. Hypoxia creates a situation where the cells in your lungs have a hard time respiring and processing your oxygen. This results in trouble breathing, as well as cognitive dysfunction due to a lack of oxygen reaching your brain. 61% of all drug-related deaths are as a result of heroin. Overdoses often lead to adverse effects, such as coma, permanent brain damage, and even death. Even though these drugs seem cheaper than prescription opioids, and they are still not cheap. A single use of heroin of about 0.1 grams costs anywhere from $16 to $274, which doesn't seem like much on the lower end of the scale until you consider that addiction causes users to take several doses per day, which can be several $100s or more. This is something that people cannot afford. However, due to addiction, they will continue to use it and eventually have resorted to illegal means to get the money. Some examples of crimes committed by heroin users during the opioid epidemic include burglary, shoplifting, prostitution, and even murder. The user is not the only one at risk when drugs are present. Everyone is, and this is why it needs to stop now. Look, I know that many of you don't think that this is a big deal, but it is. The problem is everywhere. It's much greater than you think. People are dying. And it's not okay. Right now, in Massachusetts, law enforcement agencies and hospitals are seeing some of the highest rises of opioid-related deaths and crimes than has ever been seen before. Fortunately, we can do something about it. If you are considering using such substances, stop considering. Just don't do it. Parents, if your child has been prescribed an opioid as a painkiller, ask yourself, can they endure the pain long enough to receive a lower prescription, such as Tylenol or alternative medication? This is where the problem starts. Don't let it happen to your child. If you are prescribed an opioid, ask yourself the same question. If you are currently using heroin or other drugs, seek help and stop now. People are dying by the thousands every year. These numbers must be brought down, and it all starts with you.